Shall I do it?
Done.
Done.
Okay.
Everyone please switch off your mobiles. Okay? Thank you. Can everyone hear me now? It's my pleasure on behalf of Manovikas Kendra to welcome Dr. Swaminathan. Dr. Swaminathan is a pediatrician and a clinical scientist recognized for her research on tuberculosis and HIV. She served as the chief scientist at the World Health Organization from 2019 to 2022 and was previously the Deputy Director General of Programs. Dr. Swaminathan's expertise lies in pediatric and adult tuberculosis, epidemiology, pathogenesis, and the role of nutrition in HIV-associated TB. She serves on the board of many influential global health organizations, showcasing her commitment to advance healthcare policies and research initiatives. Dr. Swaminathan, thank you so much for honoring us with your presence. Our children would like to welcome you to Manovikas.
Oh, thank you. Thank you so much. Thank you. Very nice of you. Thank you.
And without taking anyone's time, if I can request you to take the floor, then.
Want me to just speak from here?
Wherever you like.
Yeah. Is this mic working? Can you hear me?
It's for the live only.
Oh, that's for the live.
Okay. Does she need the? I think people can hear also, and that is for the live. Please, could you?
Use this.
Madam, little louder is that? So I think that also.
So we'll see. I think I'm quite loud enough. Okay. So good morning, everyone, and thank you so much for inviting me to visit. And I'm so happy that I did get a chance. I've not been to Kolkata for a very long time. It's really nice that Dr. Anuradha invited me, and I was able to combine a few things to be able to spend 2 days here and meet several groups of people. So I did not expect to be giving a talk. I thought we'll have much more of a informal interaction, because I think I can learn as much from you all as I can teach you, and I'm certainly no expert on mental health. But as was mentioned, I am a pediatrician by training, and therefore I have a deep interest in disabilities and various kinds of cognitive and physical impairments in childhood, and how much intervention can actually make a difference. And you see that in places where that type of access to interventions are available, that the children grow up to be very productive adults, confident, and they're able to contribute to society. But on the other hand, if those early opportunities are not there, then of course the things can turn out very differently, and that these children unfortunately then grow up to be a liability on society and liability on their families, obviously. I think there is a big issue of equity here as well, and this is something that I have been very interested in, because my own research has been on tuberculosis, and tuberculosis is a disease of poverty. Even though it's an infectious disease, it is an airborne bacterium, Mycobacterium tuberculosis. So theoretically everybody has the same chance of getting TB. And yes, you can, whether you're rich or poor, you could get TB. But if you really look at the data and the statistics as to who gets TB, you will see that across country there's a disproportionate burden of TB among the poor, and there's a lot of data that shows a correlation between. And very recently there was a trial that was published in the Lancet called the Rations trial, which showed that if you gave nutritional support to the families of TB patients, not the TB patient who should get support anyway, but if the families of TB patients get enough calories and protein, you can cut down the incidence of fresh TB occurring within those contacts by almost 50%. That is better than any vaccine that we have for TB. The BCG vaccine only protects for the first few years of life, and therefore food as a vaccine is something that has been proven now for TB and probably will have similar effects for other diseases. You know, diet and nutrition also play a big role in the burden of non-communicable diseases, probably including mental health disorders, but as yet those areas I think are still being researched. What is the link between your microbiome, your diet and your mental health status? And there is a good, I think there's enough for us to know that there is a very strong connection between the gut and the brain, but exactly how that is triggered, what the neurotransmitters are, and how you can actually modify the microbiome to almost use it as a treatment for mental health conditions, I think is something that needs much more research and exploration. And it's very impressive to see the Biomedical Research Center here and the work that you're doing. And I'm sure in future years we will see a lot of research coming out of here that will throw light not just on the understanding of pathogenesis, but also it is through that we will understand how to treat. One of the things I felt what was lacking in our medical education was the understanding the basic biology or pathogenesis of disease, particularly on the molecular side. And today, in today's world, I think one can no longer hope to address the burden of diseases that we have without understanding them at the molecular level. And this also impacts on treatment, because if you use drugs without understanding their molecular mechanisms of how they act, you can inadvertently cause a lot of other unanticipated side effects, etc. So not just the drug-drug interactions, but also how drugs may cause, you're trying to treat one disease and then it ends up having an effect on something else. So this is why I think one needs to take a holistic approach and not an approach that is organ specific or specialized. But anyway, we live in a world of very specialized medicine, but sometimes you recognize the need to have somebody who's more of a generalist who can put everything together and treat you as an individual. I think that's what people with disabilities need as well, because I think most individuals with disabilities probably have a combination of mental, of physical, and different disabilities and gaps and needs which need to be addressed holistically, which is I think what is being very well done here at Manovikas Kendra, where you're seeing the child as an individual and addressing each and every need and tailoring the interventions to that. Now, when I joined the WHO at the end of 2017, or before that when I was the DG of ICMR, I think just at around that time in 2016, 17, we had the first or at least the most recent survey of mental health disorders of India come out, that was led by NIMHANS, that showed a very high burden of mental health disorders. About 13% of Indians had at least one had history of a mental health disorder. Of course, the most common were anxiety and depression, but this was pre-pandemic, and I think if the survey were to be repeated today, and I don't know if there are any plans of repeating that mental health survey. Of course, it's a very large exercise, and we need something like, maybe it should be included into the National Family Health Survey, which over the years focused on maternal and child health, then expanded to cover some other diseases like non-communicable diseases, but I don't think really touches on mental health. But from surveys that have been done, smaller ones or surveys in other parts of the world, what we know is that the prevalence of mental health conditions has increased quite a bit after the pandemic, and one can understand why that is, particularly among young people. So I think what is most worrying that the 18 to 25 age group traditionally was the most optimistic age group. If you really look at, if you look away and look at optimism levels across the lifespan, the very young and the very old are generally the people who are most happy with their life. But today, it is people in the oldest age group actually that seem to have the highest levels of satisfaction with their life. And it's 18 to 25 age group that has most anxiety and that is showing the maximum signs, you know, of mental health abnormalities. Now that is very, the 18 to 25 age group is the one that is the future and has many challenges that they, you know, they have to get through college, they have to look for jobs, they have to build their career, etc. So understanding why that is a reason, and I think there are multiple reasons. Of course was the pandemic and what it did to especially young people, and I'm sure the children who come here were also very badly affected, and it was good to hear that many of them were able to cope, you know, through online teaching, and they were able to still benefit. But we know that there are millions of people who don't have access to online teaching, at least in a systematic way or in a way, and therefore whether it was this type of interventions that you all provide, or whether it was just regular schooling, there were literally a couple of 100 million children around the world who lost out at 2 years of complete educational gap. And there are many estimates now the World Bank and the IMF and others have made as to what those 2 years of educational loss are going to translate into in terms of economic losses for the country. And it's pretty big. It's pretty big when you really look at how the GDP may be impacted in the future. We're not seeing that impact today, but that generation that lost the 2 years of education and that really could not be made up through online, those gaps will come up. And when I travel around and speak with young people, I do see, especially those who come from more marginalized communities, the difficulty in actually being able to cope now with the exams. Children who stopped going to school in class 9 and today are being asked to take class 10, 11, 12 exams are not able to clear those exams because they did not have the support that is needed either then or today. Some state governments have made efforts to put in place additional classes, mainly through volunteers, you know, working in their own communities, etc. And while those would certainly help, I think the impact is pretty large and would need some sustained interventions from the government as well. So the pandemic and this type of disruption to schooling, disruption for social interactions, which are very important in the very critical time of childhood, adolescence. As adults, we felt, you know, the acute sort of anxiety and loneliness of being cooped up and not having, being able to be friends and peers and colleagues as usual. So you can imagine a child who really needs that space and that social interaction with their peers, what happens to their emotional development as well. So again, it is not just on the educational achievements, also on the social skills and on the emotional growth of a child that type of gap had been. And we are not even talking about those situations where there was domestic abuse. There is again data that violence against women, that violence against children, that trafficking of children, all of these things actually increased. And again, of course, the ones impacted were the families. Now, there is also another crisis that is probably even worse than the pandemic, and that is the climate crisis. The pandemic at least was a finite, even though it lasted for 3 years, and of course we know the virus is with us, not going away anywhere, but the public health emergency that was announced on 30th of January of 2020, that was called to an end by the WHO in the middle of 2022. So COVID is no longer public health emergency, though of course like other pandemics, we've got the TB and HIV and so on. COVID will continue to be that, but on a more chronic level. But I think the climate is getting from bad to worse. And every year at the COP, which is going on now in Dubai, we have the COP 28. We get the reports from the IPCC and other scientific groups describing how bad the situation is. A few years ago, we were hoping to limit warming to 1.5 degrees centigrade. Most people believe that that's no longer possible, that we have reached so many tipping points. There were 9 planetary tipping points that had been listed, and we have crossed, I think, 7 or 8 of those tipping points, which means that we have set in motion certain irreversible declines. Whatever we do will go along a certain path. Glaciers melting is an example. And so I think what is still trying to be done is to limit it to as less a rise as possible. Even if 1.5 degrees is not attainable, we need to keep it below 2. So the lower the better. And if you start going above 3, 4 degrees and all that, then of course large parts of the planet will become unlivable. So I mention this because there is the whole concept of eco-anxiety that has been described, and that's one of the things that is actually affecting young people, is this concept of eco-anxiety. So any young person who's aware of what is going on and who can see the changes that are happening in nature, and that's reading up on what the global situation is. And then of course we know people like Greta Thunberg and many other young climate activists basically are saying that the world, for them, they are going to have to face, the generation of adolescents and young adults will have to face a world which is warming and which is going to have all these problems of water shortage. Many areas will become uninhabitable and so on, calling actually upon world leaders to do something much more to change the status quo. Again, we see the same inequities playing out here. That is, the countries who contributed the least actually to the CO2 causing the global warming are the ones who are paying the heaviest price. The small islands, which will all likely to disappear. In fact, the coastal cities of India, including Kolkata, Mumbai, Chennai, all of these have a danger of getting submerged before the end of the century, by 2100. So for us, it's very hard to imagine that the city that we live in may no longer exist one day, but that is what the science is telling us now, that the sea level rise, if it continues, then we are all at great risk. And Chennai, we've just faced a terrible cyclone, terrible situation. And now there's a lot that's talked about the mental health impacts of climate change, but if you actually start looking for data, there's very little. And there is data on people who've faced an acute event, like for example, a cyclone or an earthquake or a flood, and they've been displaced and their life has been thrown out of gear. Obviously, if you go and interview them, you are going to document a lot of anxiety, depression, and of course people who have underlying mental health conditions, these things always make it worse. But what is not so well documented, I think, are the chronic long-term impacts. If you live in a place where there is chronic water shortage, if you live in a place where you're exposed to heat for months at a time, heat plus humidity, we are yet beginning to understand what it does actually to the human biology. And the heat plus humidity combination is extremely dangerous. There is something called the wet bulb temperature. So once the temperatures go above the wet bulb, which means that the heat and humidity index crosses a certain threshold, and even at night the threshold is not, the temperatures don't come below. That's when you start getting those very serious physical impacts on the human body, and there's some work to show that you can start seeing those cardiovascular changes, a higher heart rate and so on among people at rest. So, when you measure heart rate at rest, you should have a resting heart rate. If that resting heart rate itself goes up, the baseline goes up, that means that the heart is working much harder, and this is one of the effects of chronic heat. So, obviously, that person cannot do as much work as they might have done in the past, because their heart already works harder, and so if they try to do more physical exertion, they are going to have challenges. So, I think we have only scratched the surface of what these changes in climate, whether it is heat, whether it is air pollution, which is again a big problem in many of our cities. 97% or 99% of the world today lives in places where the air quality does not meet the WHO air quality standards of 10 micrograms. I think they've reduced it to 5 now, but even if you take it, India has a cutoff of 40, which is 4 times higher than the WHO standard, but I don't think any Indian city meets that standard around the year, a few maybe. Similarly, if you look across Asia, across Africa, you'll find most of our highly populated cities are the ones, and these are the rapidly growing cities where development is occurring, more people are migrating to cities. You'll find the air quality for most of the year is way above the WHO limits, and again we are understanding more now about the impacts of air quality. People would think air pollution means if you are asthmatic, you are affected. If you have a lung problem, you are affected, or that you'll get a cough and you'll get, pneumonia maybe. But that's not the only thing. That particulate matter and all the other things which are in the mix of pollutants impacts not just the respiratory system, because these micropollutants actually are able to get into the bloodstream. That's why the PM 2.5 is very dangerous. In fact, we know now that diabetes, for example, type 2 diabetes mellitus is brought on and be aggravated by exposure to air pollution. I remember seeing data many years ago from NFHS, I think it was NFHS 3, which showed a correlation between type 2 diabetes prevalence in households and indoor cooking using solid fuels. And at that time I used to wonder, what is the connection between these two, cooking on using solid fuel and exposure to smoke. In fact, it was Dr. Padmavati, the famous cardiologist, who in the 1950s and 60s described that in India women have more COPD than men. All over the world, COPD, that's chronic obstructive pulmonary disease, is more common in men because smoking is more common in men. But in India, she found COPD was almost the same or higher in women, and the reason was exposure to indoor air pollution because of the cooking with solid fuel. Of course, that has come down dramatically now. We have a lot of schemes that supply free LPG cylinders, etc. So the government has, recognized this as a big health issue, and the scheme, I'm just forgetting the name of it, but yes, the Ujjwala scheme, yes, that's right, has made a big difference in terms of providing women with a much safer alternative. But it just goes to show that you need science and you need good analysis to look at these large data sets that we collect and make correlations and then try to find a biological. So at that time, if someone had told me that cooking on a wood fire and diabetes are linked, I would have said, no, how can they be linked? Diabetes occurs because of a lack of insulin production by the pancreas. But if you then, now we understand how exposure to pollutants creates a pro-inflammatory environment in the body, and that the pro-inflammatory cytokines, etc., will have damage on so many different organ systems, and that they could possibly also have an impact on the insulin producing cells of the pancreas. Of course, it needs a lot of detailed work, research to prove those correlations, but I think the big, the information that we get from large data sets is underutilized in our country in particular. We all collect a lot of data, but we use it to make these kind of associations which can help us actually improve our public health programs. So, coming back, I think to, we were talking about climate and its impact and the need for more research on the different implications of global warming and climate change on both physical and mental health, and not just research to find out the associations, but to find solutions as well on how to adapt, how to mitigate, how to prevent, and how to manage some of these things. It's going to be, I think, a growing need to address mental health routinely, and of course, again, there the challenge is a lack of trained personnel, psychiatrists in our country. I think we have a total of 7,000 psychiatrists, which for a population of 1.4 billion, as you can imagine, is hardly anything, and that too they'll be mostly concentrated in the cities. So, what do you do in a situation like that, where the mental health needs are spread out all over the country, and you have expertise only in some areas. There are solutions, and this is where technology, digital technology can be used. Many years ago, when I went to NIMHANS, I saw that they were using the platform called Echo. We are all used to Zoom now, so Echo is nothing but the same platform is used, the Zoom platform is used, but it is the way in which it is used to actually build capacity, train, mentor, and improve. Ultimate aim of Echo is to improve health outcomes. I can never remember ECHO, but HO is health outcomes, I think. So, it's a way of, and it was started by actually a friend of mine from AFMC. He was Dr. Sanjeev Arora in University of Albuquerque, New Mexico, and you will think, why in America, what's the problem? But he is a liver physician, and he used to see people with end stage liver disease and in the university hospital. So, when he asked them, why did you come so late? They said, we have been waiting for an appointment for the last 6 months. So, he said, but this was hepatitis C. If it had been treated in time, the patient need not have ended up in this kind of end stage liver disease. So, then it occurred to him that the primary health physicians who are spread out all over New Mexico, which is I think also a very rural state, did not feel competent to treat hepatitis C. So, he started this program saying, why should we not build the capacity and why should patients not get good quality care through wherever they are located, right? So, the whole idea was that the specialists who are sitting in the university hospital can actually do and it's not just taking some classes theoretical, but the whole idea was you discuss cases. And so, if you have 25 physicians connected, each one of them has a few patients in the clinic, 1 or 2 of them present, there's a discussion, and the experts obviously are giving their inputs, but it's a very democratic process, because I participated in many of, I became a champion for ECHO after seeing what NIMHANS was doing with it. So, when I visited NIMHANS, Bihar had just introduced prohibition. This must have been 2016 or 15. And so, what was happening is there were a large number of people in the rural areas of Bihar who were suffering from alcohol withdrawal, acute alcohol withdrawal. And the primary healthcare center doctors did not know what to do. These people many times coming in with seizures and things like that, what drug to use, how to use, what's the dose. So, NIMHANS was doing this for how to manage this alcohol withdrawal, and I could see that there were about 50 or 60 doctors from all over East Asia connected, and this case-based discussion was going on. And over a period of a few months, obviously the doctors there become very confident. Then as the head of ICMR, I said we have to use this much more in India. So we set it up for TB, so MDR TB was one of the things that started happening. Now many state governments have an MOU with them, and they're actually using them. They've grown a lot, and now I'm hoping through the Swami use it for farmers, for agriculture, to take the same type of methodology, so that you can bring the latest, in science to farmers who may be scattered all over and who may not be getting the right information at the right time. You can imagine many such uses. They're using it for education now as well. So the platform has been widely accepted and recognized, and like I said, it's just a Zoom platform, but what it is the methodology of how you do it. Now the government has a Manas program. I've not personally seen the how it operates, but apparently it does reach many more people. So during the pandemic, again, telemedicine and telehealth took off in a very big way because of the need and the necessity, and I think there is a lot of potential in these digital tools to reach out to people with specialist advice, even if they are in a very remote setting. Years ago, I was up in Long district of Lahore and Spiti, and there I saw a local district hospital which had been connected to Apollo in Chennai, and there was a patient there who was conversing with a pulmonologist in Apollo Chennai. So even long before this was being done through the private sector, now the government is also scaling this up in a very big way. But you also have other ways, and that is through training people who are not psychiatrists. So they could be MBBS doctors, they could be nurses, or they could even be community members who have some aptitude and some very basic education to actually provide at least basic mental health services. And many NGOs have shown that this type of approach does work, that at least that initial screening and immediate attention, some counseling, but also referral can be done by people. Nurses is good if you can get nurses and train them, but otherwise I think even people without a medical background, probably with the right kind of training and supervision and mentoring, could perform. So again, the NGOs have shown this type of model actually could work, but again, that needs, if NGOs are doing it, you can have limited impact. This has to be scaled obviously through government in order to have a bigger impact, but I think it can be done with the kind of commitment that government has to universal health coverage through Ayushman Bharat. I think if you're talking about universal health coverage, we're talking about physical and mental health both. The physical health may be slightly easier to deliver than the mental health services, but we have made progress. We, for example, have a national suicide prevention strategy and plan. Again, the implementation of this, I think, varies by state, but it's very clear that a lot of the suicides can be prevented with the timely action, and India has still a significantly high rate of suicides. And you see, the sad thing is that it is again women in the 5 to 40 age group that have the highest incidence of suicide. A lot of it may be because of their own domestic issues, but also the lack of access to the right service at the right time. So again, we have NGOs who are doing wonderful work, and I know many of them, and I've been involved in actually trying to mobilize support for this national suicide prevention strategy. So we have a very good national mental health strategy and plan, a national suicide prevention strategy and plan. So I think, and a district mental health program that was very well visualized by a very visionary IAS officer called Keshav Desiraju, who unfortunately died tragically a few years ago. But when he was health secretary, he really championed the mental health issues, which had been quite neglected. I think in the past, this was somewhere around 2011 to 13, and that's when the National Mental Health Law, a very progressive law, which really talks about, non-discrimination and the rights of people who have mental health, mental illness, and also then the national mental health policy and plan, and the district plan was developed. So all of that was done. It's been, I think, almost 10 years now. So certainly I think, and it is recognized even by the WHO as one of the most progressive national strategies and plans. But again, as in most other things, the challenge comes when you have to implement. And so that is where I think different states have made progress, more or less progress, and there are some states that have done very well and that have been quite innovative also in their approach. The Center for Law, Mental Health in Pune runs actually an observatory, which I think they've named it after Keshav Desiraju. It's a mental health observatory of all the policies, actions, interventions, data that they collect from all over the country, and they try to keep it in one place. So I think that's quite a useful resource to have. And then finally, I think on understanding the basics of etiology of many of these diseases, we still don't. We know a lot now about, I think, the genetically determined diseases, at least the ones that are monogenic, which you can, or chromosomal disorders, where you can obviously identify, you can do prenatal screening and testing and counseling, and so the prevalence of those kinds would come down over time, like Down syndrome, for example. But those which are multifactorial, polygenic, more complex, I think we still don't fully understand how much is a genetic, how much is environmental component. There's a lot more research needed. And then of course we also see the growing burden of dementia now, as we have an aging population. It's a good thing that our life expectancy, which was 32 or 33 at the time of independence, today is over 70. So that's huge progress. But clearly with that also comes the problems of the increasing burden of non-communicable diseases, and now we are seeing also dementia. And that again requires, I think, a lot of a lot of focus on what type of interventions can be done, because it's not a condition where you put people in a facility or a hospital. It's something that has to be managed largely at home or in the community. A good example of community coming together and managing, which I think in India we see in Kerala, because there the local bodies, the panchayats, are so active, and the Kudumbashi groups are so committed to the welfare of their own communities, that it is incredible that even palliative care, which is something that maybe in many parts of India one dreams about, you see it happening in action in Kerala. When you, thanks of course to Dr. Rajagopal also and Pallium India, but he, I think, single-handedly has raised awareness on this issue, and also about the fact that palliative care is not something that you should be associating only with cancer, which many people think it's basically about pain relief and cancer, but it's not. Palliative care is much more than that and extends across many different diseases, and most importantly it's addressing the needs of the patient and their family. So it could be somebody with dementia, it could be somebody with some other physical or other handicaps, which is a chronic burden on the family. So how does the family get to address? So in Kerala I saw how the panchayats actually play a role in supporting those families, whether it is through education of the children or food or other kinds of housing. They come together, the community comes together. Similarly in Thailand, I've seen as part of their entire primary health care, which they are one of the pioneers and leaders. I did travel in Thailand, starting with a medical college hospital down every level of the health system to the village, where I saw peritoneal dialysis, for example, happening in people's homes, where the family had been trained to do peritoneal dialysis very nicely and successfully. And another example was this community, sort of a rehab place, where they had two staff, a physiotherapist and somebody else, where the village could leave both the elderly people with disabilities, people say who are recovering from strokes. I think it was an adult facility, I'm not sure if there were children there, but and then they had all local physiotherapy equipments, you know, the traditional equipments that are used even in India. You can, all these rollers and things like that made out of wood, and it was like a creche for adults where these people, because the adults in the family have to go to work, where do you leave somebody who has a disability and go, you know? So if you're poor and you have to go to work, so this was a place where you could go, leave them, safe place. There were 2 caretakers there, took care of them. So it was like a daycare center that was again run by the community, for the community, and I think those are the kind of interventions that in the long term I think are sustainable and that serve the needs of the community, and where the community has a stake in it, they take responsibility and accountability, you know, for that. So I think that's where our health system probably needs to be going towards, where it's not only a supply side issue or a top down provision of health services, but really much more of a community engagement and a two-way or a joint, you know, the government does play a role, a very big role in provision of health services, but the community also needs to step up there as well. So, you know, centers of excellence like this one are wonderful, and you see them all over India. You see centers of excellence, and for the children or the adults who are fortunate enough to have access to these places. And, you know, I think it was your vision that 50 years ago you thought of this need. I'm sure there were very few places at that time, and you realized that there was a need, and you set up this, and you've benefited, I don't know, thousands of children, I'm sure. 10,000, yes.
It was
And
the first institute of its kind in Eastern India.
really, yes, I can imagine. 50 years ago, I'm sure that there were none. So, you know, you had that vision at that time, but even today we have an even bigger need, a growing population, the demands have increased. So we have to think of how to replicate this excellence, you know, and it's always a challenge, because I think committed NGOs kind of provide, set a very high bar, and to try to replicate that is difficult, but yet I think on the training side probably can do a lot more. I'll be happy to talk to you also about, you know, linking up with ECHO and people like that, where I think your reach can be, even though maybe physically in Kolkata you could be having a reach which is national or even global. So thank you very much. I don't know if that was what you were expecting, but thank you so much for this opportunity. Very happy to have a discussion with you.
Thank you so much. It was fantastic. Does anyone have any questions for Dr. Swami?
Actually, a lot of things, madam. Thank you very much for your very big and multiplied factors you have told about in a very short time. But I don't know, madam. Actually, a lot of things have been seen during the pandemic. But you told covered about something about air pollution, including indoor. So how much, is there any direct relation between the indoor air pollution and mental health and the impact of this? Is there any study or?
I think she's covered most of it. We shouldn't take her time.
No, actually, a lot of knowledge. I know.
We can discuss it, yeah, later. I think ma'am wants to.
I would like to point out,
Yeah.
that since you are in a position that you can help so many of these implementations, at least in policy change, I find it a challenge to start the awareness campaign, and probably we don't know how. I don't know how to reach everyone. And we try to have, we organized a few years ago, and we called it Unseen. So all these films on children and with disabilities, we screen them. But society seems not to be interested. Also, society is becoming more and more myopic with their own problems. I don't know, can somebody help us reach out? Because I think they talk about inclusive education. Everything has to be exclusive. Parents want their child to be exclusive, their education to be exclusive, for them to be toppers. Where is inclusive? So I think we're coining these terms and these phrases, but we don't know how to be inclusive. I'm saying something very vague and I'm giving you a very tall order, but we need help. We need help to reach out, to get help. 10, 15 of our instructors, 100 of our instructors can't do
Right.
if thousands don't respond. If thousands don't
Yeah.
respond, and we don't know what to do. We are trying everything, as you see, at every level, whether it is science or whether it is therapy or whatever it is. But what is the problem is people are not ready to accept or even connect. Now, this is not something the government can do, but we need method.
Yes.
We need to do this.
No, I think you made an important point, and that is how do you get messages across, and the whole field of behavioral science is something that we have not, I think, used much in our public health programs.
Integration, I was running
Yeah.
Presidency University.
Yeah,
I couldn't get one department to talk to the other. So if we could get social sciences
I know.
and cognitive sciences and biology to connect, we could have achieved a lot.
yes.
But I think the language barrier of knowledge, there's a huge language barrier of knowledge. We train and specialize so much that we forget how to talk a common language. So
True.
I know I'm posing my frustration to you, but I don't know how to sort it out. We could help a lot more people if they would listen. So sorry to do that. Thank you. Thank you so much, Soumya. You made our day. You made
No,
it
not
so
at all.
productive. Thank you so much.
Thank you.
Does anyone else have a question or a comment? Yes, please.
Your grandmother wanted to say something later. Okay.
Ma'am, from your vantage point, I mean, you know, I'm coming from the education sector, so I think I can like it. So, I mean, from the education policy coming from say over the last 20 or 30 years, you know, this inclusion thing that Urdu was mentioning about. So it used to be like in the probably during Professor Yashpal's time, national education policy necessitated like those differently able children should be developmentally matched with the other children so that they can be taught together, they can be assimilated in the society. But we don't find this approach anymore in the education sector. I mean, we are kind of, as this alienation is being continuing, so we are not training our kids, our society to be like, to be responsive to the needs of like of the students who need like a different sort of, I mean, upbringing or care. And after pandemic, when like the students are, as you mentioned, like is going to be the most vulnerable lot. And in the school system, we are not really catering to any of their needs. And this competitions thing, like we are growing every time, but at the same time, we don't really have any solution before we actually get into a situation it's like going gone out of our hands. You're right.
Inclusion is the biggest
Inclusion is a big challenge. I think that, well, a couple of things. One is documentation, research, and also publication. I think one also needs to, because we talk to each other quite often and we all understand the problem. But we have to reach across to those who are not actually deep into this issue and they may not even realize. And I've been on both sides. I've been on the policy making side as well as a researcher, and sometimes there are big gaps. By the time something becomes into a policy, it is a bit divorced from what is needed, or it is implemented in a way that's not addressing the issue it was supposed to. So I think people who are in the field, I think NGOs have a responsibility here to bring that make it visible, because if we never make it visible, then things are never going to change. And so like-minded NGOs can come together and these things can be addressed actually, because very often it's a matter of, as you said, making somebody aware, a policy maker aware. There are policy makers who are quite open, willing to change and very sort of responsive. But if nobody ever goes to them with the issues, then they can, I'm not saying it's easy or it would be done for every time. Sometimes change takes a very long time. And in the mental health space in particular, I think there have been huge disasters and terrible things which have happened, which have actually spurred action from the government, you know. So sometimes a disaster is needed, pandemic was needed
Yes.
to increase investment into health, you know,
Public health especially.
into public health. Now people realize, even the richest countries, they had uninvested in public health, and that had a big implication for how they were able to respond. They build fantastic, beautiful hospitals with intensive care units, but if you don't have public health, then you could not deal with the pandemic. So similarly, I think sometimes it's an acute shock, sometimes it is slow and incremental, and for that slow and incremental change, I think NGOs can play a very big, important role.
Thank you, Dr.
Thank you. Thank you so much.
Thank you.
Thank you for encouraging us with your conversation with us today. I can take that.
Can you unplug it?
Yes.